Whether you're a parent navigating myofunctional disorders or simply curious about optimizing your family's overall health, the Myohacker Podcast is your guide. Hi, I'm Karindy Ong, a speech-language pathologist, myofunctional therapist, and a mom on a mission to bring holistic health to you and your family. Together, we'll explore whole-body connections and integrative solutions. Please subscribe and leave us a 5-star review to help other families discover this important information. Visit myohackerslp.com for free resources and guides. Quick disclaimer. The content shared in this podcast is for information and entertainment purposes only. The views and opinions expressed by the host and guests do not necessarily reflect those of the podcast or its affiliates. This podcast does not provide medical, legal, or professional advice. Always consult a professional regarding your circumstances. By listening, you agree that the host and podcast are not responsible for any actions you may take based on the information provided. Now, let's dive into today's episode. Welcome, everyone, to the Myohacker Podcast. With us today, we have Kim and Holly. They are here to tell us about the amazing CFT Gillespie Approach. This is a modality that I use every day in my practice. I love it. It is a game changer, and I want more and more people to know about it. So I'm going to have us do some brief introductions where Kim and Holly will tell us a bit about themselves. Then I have a bunch of questions that we're going to dive into. So Holly, start us out. Tell us a bit about yourself and what got you into the Gillespie approach.
Well, that's kind of a longer story, and it's not that interesting. Well, it's kind of
interesting one then.
For the last 10 years, I was introduced to CFT. I had a private practice of other modalities, and it kind of just took over without me trying to do that. I just started to get more and more CFT clients and starting to work on infants and kids. And my practice just really turned into exclusively a CFT practice. But during that time, Kim and I had met each other. Barry introduced us, and we ended up in 2015 starting to teach the Gillespie approach as Barry was retiring. So this is our our 10-year anniversary. It's 2025, and it's grown. It's been a very amazing grassroots movement of spreading the word of CFT. It's such a unique modality with just amazing results. And we're really happy to be teaching it. And that's what we're here to do, is to get the word out about CFT and to get more practitioners out there, because we just get tons and tons of emails about how can I find somebody in, such and such place. And we really just need more practitioners. So that's what Kim and I have been doing really full time for the last 5 years, just teaching CFT and spreading the Gillespie approach.
Wow. And I'm so glad that you guys do. And you travel everywhere. At this point, do you know how many countries you've been to teach it?
Well, that's not that hard to count. We haven't been that many places. But
you've been to Madagascar, and I feel like you guys are traveling.
Yeah, we went to the Maldives to work with a little girl. We've taught in the UK a couple times. We taught in South Africa and a few different locations there. But mostly we're sticking to the US because we just have such a need in the US to get people trained.
But we do get requests. I mean, just in the last month, we hear from Australia, India, Italy, UK, so South Africa. So we are getting a lot of requests. It's just a matter of gathering enough interest for us to, travel over there and do that when we can. Yeah. So
let's talk about that real quick. If someone is listening, because I actually it's so fun. I'm like, there are people listening in Slovenia and Argentina and all these different places. Let's say someone is listening in another country. What do they need to do to actually get enough? Like you said, you need to get enough interest. What does that look like? How many people need to be interested in a course and committed to signing up for you guys to travel there?
Well, we typically have about 40 people in our foundation training. And 24, we only take 24 for the infant training. So that's, they're kind of the numbers that we're looking at. And that person who coordinates, if they are coordinating the infant, really need to have access to a lot of babies, because we bring in about 30 babies over the 3 days that we work with. So that can be tricky. It's a challenge. managing, finding all those babies and parents and managing all them and scheduling them. But in exchange for coordinating, you do get the classes for no charge. So that's typically how we work it. As far as the U.S., we've been, we should really do a count, Holly, of all the states.
You should, a little map.
I'd like to hit all of them, yeah. But that's where we are now. Pretty much, I'd say every other month or so, we're traveling somewhere. And it's really fun. It's really fun to meet everybody and to be kind of, planting all of these practitioners throughout the country.
So the takeaway, guys, is you need 40 people for that foundations course, 24 people for the infant course, and you need to have babies. So we can talk about that a little bit more because that is a big part of the coordination of the course. But I actually want us to now dive into, okay, what is CFT? What does that even stand for? Like, what are CFT? What does that mean? And then how is it different from like craniosacral therapy? Is it any different? Let's talk about those things.
Sure. I'll take that one. So I'm Kim. Obviously, that's Holly. I'm Kim. And so I've been in this since like 2008, learning along the way. So CFT stands for Craniosacral Fascial Therapy. It's a lot of the same words as craniosacral therapy, but it is different. And craniosacral fascial therapy was developed by Dr. Barry Gillespie in the 70s. He was looking around to help himself heal from headaches and TMJ. And he met up with some osteopaths. He was a periodontist up in the New England region. And he was everywhere at all the hospitals and doctors, and nobody could tell him what was wrong with him until he met a chiropractor who told him that he had restricted cranial bones, which he had never heard before. Mm-hmm. So osteopathic principles, they were able to help him, and he became very interested in this. So he started to learn from the osteopaths. He started to bring this work back into his periodontist practice, work on his patients, and he started to see these great things happening for them. Later, he met John Barnes when he moved back to Philadelphia and started to incorporate some of the myofascial release techniques that John does. And he also brought into it this whole oral structure piece as periodontist. Mm-hmm. So it's kind of a three-prong approach that we're, working with the craniosacral system, the entire fascial system, which is everywhere, head to toe, and particularly in the mouth. So that's what makes craniosacral fascial therapy different than craniosacral therapy. So the craniosacral system, brain, spine, sacrum, is lying within this whole web of fascia. So how can it be separate? Mm-hmm. And it's not, because there have been studies that have shown that cerebrospinal fluid is found out into the fascia. So it's an all connected system. So we're looking throughout the body to find the tightness that makes it down that craniosacral system. So that, is kind of what sets us apart. I think it's the most efficient way into the body and into the craniosacral system, because it's a very, like with our babies, we say it's infant driven movement. Mm-hmm. We're really following the body to see where that body wants to go to release tightness and trauma.
Mm. Which I love. Yeah. So with CFT, are you pushing anything? Are you forced? By the way, guys, some of these questions I'm setting up. I just want to ask these questions, but are you pushing or forcing movement?
There's no force. There's no manipulation. Excuse me. There's no protocol. So, first of all, we're teaching, and we are, as practitioners, we're assessing the system. We're feeling for how much tightness there is in the system. We have a very cool tool to do this called the brain cycle. Mm-hmm. We gently lay our hands, just on someone's head, and we're feeling for expansion and contraction, kind of like craniosacral, but it's a different rhythm that we're feeling and tuning into. And that right there tells us as a practitioner how much tightness there is in the system. And it's very affirming, if someone comes in and they've got all these issues and you feel them and they don't have a brain cycle, it's a very quick cycle. We know that, hey, maybe we might be able to help. We like to often say that we're the missing piece, because mm-hmm. no one's looking at the fascia in whatever it is your condition is, whether it's headaches or migraines or like I had a little boy yesterday that has tics, different things, different issues that could be related really to this tight system. Mm-hmm. And then as we work, we go back and we check. And when that improves, we know, okay, something has happened. And then we're going to see, how does the person respond? And typically there's a high correlation between them feeling better, symptoms resolving, and the quality of the brain cycle and the timing of the brain cycle.
I would love, well, I'll come back to this. I want to talk about sometimes people and their kind of responses to CFT. So I'll see sometimes people will have this delayed response where they might almost get sad or like a different emotional release. And kids seem to work through it faster. Adults, I feel like there's about a 3-day window where they might still be maybe integrating, or I don't even know, maybe just a different awareness of their body and they're having some changes. What do you tell people to expect after a CFT session?
That's a good question. We don't really know where anybody is on their healing journey. Yeah. And everybody is just, made up of so many different, they're just such an individual. Yeah. And we're not doing anything as we are not healing anybody, so to speak. We're just a witness there. We are following their innate wisdom, and we're sort of offering a better way for the body to be able to function on all levels, physical, mental, emotional, and spiritual. So everybody's just in a different place with their story, with their healing journey. And we don't know, what's going to happen. So generally we tell people, the fascia releases emotions, it releases toxins. So you may have an emotional release. It could be, you might know what it's about and you might not know what it's about. That's okay. That happens all the time. And then with, the fascia releasing toxins, we tell people just a general protocol for what they do in that situation. A lot of people, drink a lot of water, maybe an Epsom salt bath. If you take binders or other, types of, things in that way, whatever you do, to help your detox, we tell them that. We don't try to front load it with a big story about that, because in general, people's bodies, they handle that pretty well. And it is a really gentle modality. And you know that because we work on babies that are, brand new babies. We work on people that, are very restricted, mobility wise, older people. We work on a lot of pregnant women. And, we're always following their body and their movement and what their body wants to do to guide them into that place of healing. So we don't really have to worry too much about that detox and hurting somebody at all.
I just want to add to that about like where we can use this. It's not like limited to someone has to be on a massage table for you to be able to use this modality. My aunt, she had a surgery and was recovering after the anesthesia. And she's just like, oh, my head, it hurts, the back of my head. And I just felt, and I could feel, the brain cycle was zero. Everything was just shut down. And I wasn't doing anything crazy. If anyone had looked in, it would look like my hand was just on her head. Nothing wild, but just that, doing the gentle input that we have with CFT. And she was able to then, like, the agitation reduced. She was able to rest and finally able to say, like, she didn't actually ever tell me I don't have pain anymore, but she fell asleep and was able to relax, and just the pain you could see in her face went away. So it's something you can incorporate with someone that they're even hard to reach. It's a beautiful way in that we can use it so many different places. So I would love to know, what kinds of issues are you commonly treating? Things like tongue tie, colic, torticollis, like what specifically brings people to your practice most of the time, or even just practitioners in general?
In the infant world, we've got the first red flag we see are babies that don't latch well. Yep. So we've got nursing issues, sucking, reflux, crying, fussy, tight, not sleeping, not pooping, just all those joyful little baby issues that happen. So when we help release tightness and trauma that may have happened in utero, just a positional strain could be enough. That was, causes them to come in tight, or whatever their birth experience has been. And sometimes we know there's trauma, sometimes we don't. That can help clear all that and just kind of give them like a blank slate, I'd say, to move forward. And then we hear baby pooped when they got home. Baby slept 3 hours. They never done that. They slept through the night. They're so happy. My husband said, what happened? This is a different baby. It's like they finally come into themselves because they're comfortable in their own bodies. Move into the kids, you might see things like ADD, ADHD, the asthma, headaches. I had a little boy yesterday. He's 9. He's got headaches, like 9 years old. You shouldn't be having headaches, and all different kinds of conditions. There may be more complicated conditions, but they're kind of the general things, lack of focus. And I'll also go back. I didn't say tongue tie on the babies, but because this 9-year-old had a tongue tie that no one knows, and, he's got all kinds of issues, and we don't diagnose tongue ties. I'll be very clear about that. And we don't release tongue ties. But being in this long enough, you can start to see, and you start to partner with dentists and lactation and other professionals, OT, PT, that we can all kind of be on the same page to help that person find who they need, in the process. So yes, we still see a lot of tongue ties. And what we do is we help release tightness before. Sometimes it's not a tongue tie. Sometimes it's just tightness. And so when we do CFT, we can maybe release enough that we're making progress. If there is a true tie, then we do work with a dentist as well. So I'll be clear about that. And then on the adults, we see, headaches, a lot of migraines, concussions for kids and adults, anxiety, depression. My neck hurts, my back hurts, my hip hurts, scars from surgeries. It's just like, it's endless. Airway issues. It's endless. There's so many different conditions. If you ask Barry, who needs this work, he really says anyone with a brain. So
I love that.
Comes in and says, I feel pretty good. I'm just, checking it out. They still have, good results, because we're also helping regulate the nervous system. And you can't heal if your nervous system isn't regulated. So
can you tell how CFT helps with regulating the nervous system, like specifically cerebral spinal fluid? What's happening there?
Yeah, well, we're working with specifically the vagus nerve. So if there's tightness squeezing the vagus nerve, which is a big nerve, starts in the brainstem and goes, all the way down really into the pelvis area through many organs, but it's also responsible for the parasympathetic aspect of the nervous system. If there's tightness and that's being squeezed, that's not working optimally. So when we release that, that's where you can start to finally feel that you can see it. You can feel it on the client, how they just start to let go. And sometimes they just leave a completely different person than they came in.
Which, speaking of, go Holly.
Well, I was just going to say, and to follow that up, we all know that in order to heal, your body has to be in parasympathetic mode, rest and relaxation, healing and growth. So you got to be there. So that is one of the, things that we always tell people, regardless of what you're coming in here with, that's going to be addressed in every session of CFT is nervous system regulation, parasympathetic nervous system. And also, see, we tag team off of each other all day. Think about a baby going in for a tongue tie release. You cannot, or you should not send a baby in whose nervous system is dysregulated. You're just asking for trouble. So we really like that optimal timing for that baby's nervous system to be regulated before we were to send them for any type of procedure like that too.
So that baby is dysregulated. The adult is dysregulated. This is where I love the objectivity that we can have with the brain cycle. Can you talk about what that is and how that can give us a measure of how is this person actually doing and how are they doing at the end of the session? And ultimately, do we ever end treatment? What are those things we look for?
Well, the brain cycle is something Kim already said. We're feeling for the expansion and contraction by lightly placing our hands here on the head of the cerebral spinal fluid. And so it's a little bit different if you've studied craniosacral therapy. Kim and I have both studied with Upledger, where we're listening to the expansion and contraction, and we're listening to a 6 to 10 second in and out cycle. And one of the things that Barry found in his studies of the craniosacral system and blending these two modalities together was that there was a longer tide, so to speak. So what we find is when there's a lot of restriction in the fascial web, we're going to find that longer cycle of expansion and contraction is restricted. And so that's what we're listening for. And we want to check what their brain cycle is in the beginning of the session. That's going to tell us. And we actually, when somebody comes in with a lot of different conditions and issues going on that nobody's been able to help them with, and we feel their brain cycle, and we're like, wow, their brain cycle is really tight. And I'll explain the numbers there in just a minute. But we know that gives us some hope because we know that there's a fascial component to this condition. And we're going to free up that fascial component so that their brain cycle can improve. So what we say is that we like to feel a minimum of the expansion and contraction to be what we call 100 in the brain cycle. And what that means is the brain is expanding, or the cerebrospinal fluid is expanding for 50 seconds and contracting for 50 seconds. And we call that a cycle, brain cycle of 100. That's the minimum that we want it to be. And it improves incrementally as we continue on with CFT sessions. But that tells us when we get somebody to that place that their system is open. And we know that things are going to start to improve with the piece of fascia. So, and people always ask us this, well, will CFT help with this condition? What about this condition? What about this? And we don't know because we don't know if fascia is involved in that piece. We know within 3 to 4 sessions when we're using CFT, if we're going to help that person with that condition, we're going to start to see improvements. So yeah, so we want to get the brain cycle open, and that's the tool that we can use. That's our assessment that is really handy dandy to use, with an infant, with anybody, all the way through the spectrum of different conditions and different ages. We can always put our hands on and feel like what's happening with that expansion and contraction.
And I think even if someone is not necessarily going to go forward with CFT as a part of their treatment in whatever their practice is, having that diagnostic tool is massive. Now, I don't know why you wouldn't use CFT if you did the training, but I just want to elaborate that sometimes people, they don't want that. They'll see me for myofunctional therapy. They just want, I just want to work on this thing. And it can be so beneficial to highlight, I'm actually feeling this right now. This is having such a big effect on the body. And even, I'll see a lot of people that are going through some type of oral expansion. And if we have cranial strains or even just strains throughout the body, you will see what I typically see is in a rapid palatal expander that they'll kind of blow out to one side. One side is dominantly expanding because there's a cranial strain or there's a pattern that has not been released on one side of the body. Or even if, it's something that's gentle like the ALF, that they're not getting the results they want because they're not getting that unwinding, that full motion that we want. Do you see a lot of people who come in for oral expansion types of concerns?
Oh yeah, tons. And that winds us back down to the infants. That's why we're so passionate about getting those infants sorted out so that we don't see them going into teeth pulled, expanders, braces, all of that stuff. Because that's where, when we're looking at these infants and we're not addressing those conditions, that's where we know they're headed. And we see it all day long in our practices. We see, the 60-year-old coming in that's got, a new CPAP machine because of, and all of these conditions that go along with it. So it's just, unfortunately, our medical system is such a Cartesian model, and everybody's studying their little piece of the pie and they're not putting it together. And so we're really having to look at this, person on the table in front of us in all aspects and dimensions of their, healing process. We can't separate it out.
Let's take a moment to talk about one of my absolute favorite tools for supporting health and wellness at home, ozone therapy. I'm a huge fan of finding effective, science-backed ways to support our body's natural immune defense system. That's why I've been using the Stratus 3.0 ozone generator from Simply O3 for years. Whether it's tackling ear and sinus issues or boosting overall health, incorporating ozone therapy at home has made it so much easier for my family to overcome illnesses and proactively defend against sickness at school. As a busy mom and business owner, I love that I can support my immune health without needing to run to a clinic. And let's be honest, most of the time, when my kids get sick, it tends to be at night when clinics are closed anyways. Simply O3 makes it incredibly accessible to bring the power of ozone therapy into your home. Their equipment is easy to use and designed with safety in mind. And because you're part of the Myohacker community, Simply O3 is offering 10% off your purchase when you use the code Myohacker. Just head on over to simplyo3.com to check out their ozone generators and supplies and use the code Myohacker at checkout. okay, so we're seeing a lot of these oral restrictions, or I'm not even talking about a tongue tie. Like, I mean, there's a restriction pattern in the palate, and this person is like, I don't understand why I'm not getting the results I want with this kind of appliance or this thing. And sometimes it's because we have to release in a bigger way. It's not just about a tongue tie release. It's this whole body connectivity and just even the brain's awareness. Like, is your body tuning in to this area over here, or has it gone, we don't get as much movement over there, we're just going to ignore it and move on and work with what moves?
And think about like the level of compensation that goes along with that. When you have an infant or a kid that is compensating really hard in any area, then the whole rest of the structure of the body, of all the organs, endocrines, body parts, they all have to compensate too. And so we wonder why, somebody has a knee replacement or a hip replacement. It's the structure of the body has become so compensated over the years of, that person's life that, it's just created these conditions, and nobody's looking at that. Like, if we're not dialing it back down to, what could we have fixed for this person or helped correct the trajectory of their, going forward.
Yeah. I mean, I think of, well, let's talk about things that cross midline, because this is a question that comes up a lot, because I'll talk about it, that I see if we have like metal that's crossing midline, I'll ask, an orthodontist, please don't place that bar, because it's going to restrict things. And people will be like, well, I had headaches, but they went ahead and put this in because my swallow, they wanted to make sure it didn't mess up my teeth. And it has an impact in the fascial movement. Can you talk about even, I think, glasses? Like, it's so fascinating to talk about what is happening when we have things crossing the body and whether or not we know why we're getting these effects in the body.
That's why the brain cycle is so helpful. So, for instance, I'll go back to this little boy yesterday because he was so interesting to me. He had the expander, full set of braces, and wired glasses, and a potential tongue tie. So it was just like, and
everything. His
dad's a dentist, and it was just like,
wow.
How likely do I need to, start? But the mom wanted, the mom wanted it all. She's like, just tell me. Other parents, you may have to parse out. You have to kind of read the room of, how you're going to explain here. But, he was very shut down. He was a 0 cycle. And so, what do I do with that? I did the best I could. What would have been ideal in his situation is if I could have gotten him before he got all the hardware in his mouth. And because he has this fascial strain and pattern, and then you're just trying to put the mechanics in to, crank it open and move teeth, it's going against the force of the fascia. So by cleaning that up ahead of time, I think you can set the stage for a much, maybe easier, more optimal outcome with all these expanders and braces. They're going to do them in most cases. Yeah. We do like the ALF. It's more cranial friendly. You can still have brain motion with the ALF. So we often refer to the ALF. But, in those cases, if I can get the kid before and I can get the kid after, that's the most ideal thing, because they will shut down the brain cycle, because we've got this motion and then you're going on the maxilla here and you're locking it up. So you're restricting that motion basically. Mm-hmm. Yeah. So it's a tricky conversation. It's tricky. But that's what's going on. And that's how we can kind of, try to weave in and help the process. But
I would even say, something, because it is important to note, like, yes, I love the ALF, but sometimes for whatever reason, it's not an option. So someone is, in a different appliance, and it's not like, well, CFT can't help. It does. I used to sort of follow the model with myofunctional therapy. We often say, like, if you're in an expander, do that process and then come back and see me once it's completed. Yeah. I now don't say that. I'm like, now we're not necessarily doing myofunctional therapy because you have this thing in your mouth that I don't want you to be like burning money on sessions for things that the tongue can't actually get up there. But it makes a massive difference if we can do CFT and release strain patterns, because like I said, you might find all of a sudden that And it's interesting how other practitioners might not notice it. I think with CFT, we're just more aware of the connections in the body, and we're feeling, not necessarily, because your eyes can deceive you. They'll be like, oh, that's symmetrical, when it's really not.
Right.
And so with CFT, we can actually facilitate better changes with using these appliances, whatever they may be.
Yeah. You do the best you can with what you have in
Right.
front of you, always. And you also mentioned the glasses, Karindy, and that's another thing, that metal crossing midline. So metal glasses can also affect the brain cycle. So you feel someone, they're feeling great, they leave your office, they put their metal glasses on, and they can shut down again. So I like to ask people if they wear glasses, we prefer plastic. And if they have the metal, we can actually test it. So we have somebody without the glasses, brain cycle feels beautiful, put your glasses on, and then we come in and we feel, and it either significantly slows or can even stop the cycle. So we can test things like that. We can test bite guards. We can test, Invisalign. We can test all those kinds of things with this brain cycle tool.
And I think it's interesting. I feel like people sometimes in how, like, it comes back to the nervous system. If they're in a place of more resilience, they have just more of a reserve that they can call on. At least I don't see as much slowing versus, let's say they've been sick, they've been traveling a lot, they've had STAR testing, or recently a lot of just stressors on them. All of a sudden it's like, oh, that thing that wasn't an issue before or was minimally one is a bigger concern now. So it is something like we can, in a way, almost like meditation, how meditation gives us a little bit of that reserve to be able to draw on. I feel like CFT can provide that for the body in a similar way. It's like, I can take a breath. I can get a little bit more resilient because I've had just this release, and we're not this not tight. We actually are getting that expansion and contraction. Yeah. Let's talk about sleep and how CFT can support lymphatic system function.
Well, I just to piggyback off of what you just said about that, like, I think about how much CFT is regulating the nervous system, which is of course going to be regulating the hormones.
Yeah.
And when we see people that have a lot of, those stress hormones going on, they might not even realize it's going to affect their healing on all levels.
Yeah.
So like hormonally, we think about the pituitary is the master endocrine gland. So it's sitting right in this little place here in the place called the sella turcica. That sphenobasilar juncture where the occipital bone and the sphenoid come together, it's meant to be moving back and forth. And when that's happening and there's optimal movement there, we're seeing that pituitary get its little mini massage, and the pituitary is then doing its job to be, the boss of all the rest of the endocrines. And so endocrines are just so highly affected by our environmental conditions and the epigenetics. So we see that regulation happen really super fast with the endocrine system, with the pituitary, and with hormones and with stress hormones. So, you can kind of go on a little bit more about the lymphatic system, but it's so important. There's so much research now at nighttime when we're sleeping to be getting that, quality deep sleep, REM sleep, light sleep, all of it working so that the cerebral spinal fluid can do its job of cleaning up the toxins and, detoxing. And anything that gets past the blood-brain barrier, cerebral spinal fluid is in there cleaning that up.
That is, I wish, I see so much right now. I have so many loved ones who have dementia, and it's, I'm toggling a lot of this and kind of running back and forth, trying to help everyone. And it's so much more work when we are now at these more end stages versus if we could have addressed it sooner. And so much of it I see in family members is I see the signs of airway issues. We see the tori. I see that, okay, we have been clenching our entire life. And then they have brain cycles of zero. Well, not quite zero, because I get my hands on them often enough that we can move some things. But I just think this is something, we talk about the health crisis that we have, and we see so many people that it's like, okay, we're getting more and more dependent as we're aging. What if we can get in and help people at a earlier age. I mean, I know you guys see a lot of people who come in and get training for treating their families. Are you getting feedback from these people about how it's impacting their families?
Yeah, all the time. I mean, and it's so rewarding for us to hear, when we start class, we always do introductions, and, someone, well, I'm here, I'm just a mom. And that's, I call it the Just a Mom Club. I was just a mom. And when I started, I had no intention of getting into something like this. But when you start to see results and you start to feel the rewards of working with people with the CFT, you think, oh, okay, well, maybe, I went to massage school eventually and I started practice eventually. And so we see a lot of people who are doing this, and it's kind of cool, but they'll tell us their stories. Oh, Karindy worked on me and this happened for my son. So now I'm here to learn. And it's like, wow, okay, that's awesome. And we hear all these wonderful stories. Like, we teach and then we don't always know exactly what's happening, but there's a lot happening. And that's why it's been such a grassroots build on this work, because it's a lot of referral, one person telling another. So, that's what we see. But yes, great things. When you're a parent and you learn a skill like this, that you can work consistently with your kid, it's very helpful. And it can be 10 minutes a day. It doesn't have to be a whole big session, because for a lot of times people are maybe in a more remote area or there isn't a practitioner near them. And it gets expensive. If you've got a kid with a lot of issues that you want to continually be working, or a lot of kids or nieces, nephews, neighbors, as long as it's just kind of within your family, you can do a lot of really good work that way.
Yeah, I would say, I think I'd mentioned this, like at a lot of like weddings or gatherings, all of a sudden you find you're like sitting there and you're talking to somebody and you're just kind of hanging out and CFT is happening. And then people are like, I want to get trained in this. What is this? So let's talk about the trainings. Let's talk about how people can find out where they are, how they can get involved.
While you guys were talking, I was kind of thinking, we didn't really do like sort of I just want to do like kind of a recap of what CFT is.
Please do. Yes.
So we're working with the craniosacral system. So cerebral spinal fluid, the brain, the spinal cord, all the cranial nerves. And then we're working within the fascial web. Kim said that. And we're just assuming that everybody knows what fascia is, but it's all the connective tissue in the body. There's so many different types and layers of fascia. And what we're teaching you in CFT is to assess both systems at the same time. And what we're asking is, with my hand within this craniosacral system, and usually to tap into that, we're on the bone back here, the occipital bone, or we're on the sacrum. And we're asking with our other hand out there in fascia land, so to speak, am I feeling fascial strain between my two hands? And if so, how does the body want to correct this or unwind this or, improve this? And we're teaching you how to feel with your hands. So Kim said, we don't have a protocol. When somebody comes in and says, oh, I have a migraine, what are you going to do? We don't know what we're going to do. We're going to find out where the body is telling us that things are tight. We don't know. So that's what we're doing. That's what we're teaching you in CFT. It's a very hands-on class. You're using it right away. So we have a little bit of lecture in the morning, Q&A lecture, and then we go right into teaching you the techniques. And so how that goes is we do a lecture, we do Q&A, we do a demo on somebody, and then you guys go practice that technique. So it's a very hands-on, very user-friendly, super easy to incorporate into if you already have an existing practice, to bring that into your practice as a professional, or to go home and work on your kids for 10 minutes at a time, or your family members, or whoever you're going to work on. So it makes it's just, we can teach anybody from the mom, the dad, to a professional how to use this and integrate it and bring it into their practice to help enhance the other things that they already know how to do.
Right.
Just to piggyback off of that, when we talk about the professionals that take the training, such a wide variety. We have physical therapists, occupational therapists, myofunctional therapists, dentists, massage therapists,
podiatrists,
yes. Lactation consultants, dentists. We have doctors. So it's like chiropractors. Anything that you're doing, this can only enhance the work that you're already doing. right? Because when you free up the fascia and then you go in and you do your PT or you do your OT, now they have the freedom to, respond better.
And I think it's so important. I get a lot of questions specifically from SLPs who will say like, okay, so, we know that an OT and a PT, they have a license to touch, but what about an SLP? And here's the thing, if it is affecting their respiratory system, their swallowing in the hospital, I was working on diaphragmatic breathing, on supporting things, on doing circumlaryngeal massage. It was like, depending on what the issue is, I am able to address that within my scope of practice. Now, I am not going to take on a patient who's like, I just have Achilles tendonitis. I want you to do CFT on me. That's not appropriate for me. They need to be seeing a PT or someone else that CFT does fall within their scope of practice to be addressing these issues. Now, I do think it can be wonderful. Go ahead and get the massage therapy license. Like, I want to do that. But at this time, I am able to use CFT within this scope. And even sometimes other people will be like, well, it's something right now. I hear this from registered dental hygienists. They're like, I don't have that within my scope to be touching this person. But I think the knowledge you get, and you're going to use it on your family, like the knowledge you get though on being able to suddenly identify cranial strains and issues that are coming up, it can be so powerful. And I'll say, I don't know with RDHs, it might be different in state to state, but just the ones I've spoken to, there is still a benefit, even if it doesn't fall within your license, to put your hands on anyone. So if someone is like, well, what about the cost? I always, because they'll see it's, $2,000, I think. I want us to just mention this because I want people to hear it. I think it's $2,000 for the training, or am I less? I don't know.
The foundation training is $1,500.
Okay.
The infant training is $1,650. The foundation is a prerequisite for the infant because we really do just jump into the infant work. We talk a little bit more of the specifics to the infants, but it's very hands-on. So all that philosophy and background and history and techniques are taught in foundation. But all that said, this is not the type of thing where you have to have 10 classes before you even, your hands on someone, or you can't get into doing oral structures. It's all in one. And
we all know the amount of money we spend for body work. I mean, I know most people, they're like, okay, it pays for itself if I treat my kid this many times or treat this family member this many times. So I just want to share that. Like, if you hear this and you're like, whoa, that's a lot, like very quickly it pays for itself, just within your family and especially if you have multiple people that you are treating at home.
Yeah. Because even if you're learning it as a professional, just like you said, Karindy, which you did, then you have your aunts and you have your family members and you have, whoever you met at a wedding. And I don't tell people what I do anymore, but you're good. You're telling people and actually working on people at a wedding.
Sometimes not as much maybe as I used to, but yeah.
So it's such a valuable skill to just have a life skill. Like every family should have one. So
I just think there's such an element of like wisdom of just physical touch and human connection that I think this is why I feel like it exploded after 2020, when the world kind of shut down. Everyone went, whoa, we need this. We need to have physical touch and a place to heal, because, and sometimes I'll talk to incredible practitioners, biohackers who are like, I release myself, I do these things, and maybe they do, but I think there's a beautiful place to have that hand-on contact, to have that cellular input, the light. I mean, we know that we have sensory receptors in our fingers that are communicating with the mitochondria just from the light perspective. So all of these things, I think we want to provide a space for that so that we can continue to connect, especially in this age where it's so easy to just be digital and never actually touch a human being. Like, you can just walk around and
ask if we teach online. And it's like, we've thought, like, how in the world would we do that? Because we're teaching you how to feel. How do you do that online? It's very hands-on. And there's also the idea of like, you're being a witness in the process.
Yes.
That also comes into play when you're working with someone, because we can't see everything for ourselves.
Right.
That's why we don't do talk therapy on ourselves. We don't do massage on ourselves. I mean, you can get some relief, but it's way better when you have someone else there to assist and facilitate.
And I think just that, I know we have like 1 minute just to wrap up, but I want to say, we think of the body keeps the score, and we think of the trauma that we hold. And I think it's so important as practitioners that we are grounded and we are a safe space, because when we are letting the fascia release these memories, release what it has held onto, we want the person we're working with to feel safe and feel like this is a safe place to let that go, and the world's not going to fall apart. Any thoughts on that?
Yeah, I mean, just being able to receive. So the person on the table is in the receiving position without having to hold space for any other part of that, session at all.
Yeah.
So I just think, being, and like Kim said, we're being the witness for at a much deeper level than the conscious mind. Yeah. So we just have this small window view of our world from our conscious mind. And there's so much more going on than that piece. And, as the practitioner, we can be in a neutral space where we're making those observations and allowing the person on the table to be able to, do its thing in healing.
Yes. So how do people find you guys? What is the best way to get connected and to let you know that they want to dive in and take a training?
Well, our website is Craniosacral Fascial Therapy.com. So you can go to our website and you can learn all about the trainings there. We also do have a practitioner directory. So you may be able to put your location in and search and find somebody in your area as well. For the remainder of the year, we're going to be in Sarasota, Florida next month. I think Hollywood, maybe 1 or 2 spots left there.
Yeah, exactly that. Mm-hmm.
And then where are we heading? Indianapolis. That's almost sold out. And then we will be in Franklin, Tennessee and Austin, Texas. Yay. And just added, it's not up yet, but it will be shortly, a close to Philly location in Newtown Square, Pennsylvania. We are adding a foundation and hoping to add an infant if we can find someone who wants to take on the infant coordinator role. So join us. We're already starting to kind of flesh out what 26 would look like, but it's a lot of fun. And I like to think that it's both professionally and personally transformational.
And I would say if you're like, I know I can't personally take this training, but I wish my provider would, ask them to. That is how I found out about CFT. Was I had a patient who I was seeing for TMJ issues, and she said, have you heard of CFT? I want you to get trained in it so you can use it on me. And I was like, okay. Yeah. So let them know. Sometimes then as a provider, you just let us know that interest is there. And if we have the inkling and we're like, oh, it sounds cool, we'll do it. So.
Yeah. You can also join our Instagram page, which is CFT Gillespie Approach. Mm-hmm. So you can kind of join and keep up with all our happenings there as well. And Barry's website is GillespieApproach.com. And he's got thousands of articles that you can, kind of read through and see if anything resonates for you.
Absolutely. Well, thank you guys so much for your time. And if you are listening, please share this podcast with someone. We want to get the news out about CFT. We want providers everywhere. Again, there's just a lot in this world that CFT can really support and really help. And so I want more people to know about it, more people to be trained. Let's make Kim and Holly so busy next year with tons of trainings that they're like, Karindy, so that's my goal. All right. Thank you everyone for your time. I appreciate it so much. I hope you have enjoyed this episode of the Myohacker Podcast. Remember, small changes can make big impacts on our overall health and well-being. If you enjoyed this episode, please take a moment to rate and review wherever you get your podcasts. This way, more families will learn about this important information and we can make a bigger impact. Head on over to myohackerslp.com for in-depth resources and guides. You can also join me on Instagram at myohackerslp for bonus content and demos. And if you have questions or topic suggestions for future episodes, send me a message. I would love to hear from you. Until next time, let's biohack myofunctional health as myohackers who change the world through intentional action and connection and breathing. Quick disclaimer reminder, the content shared in this podcast is for informational and entertainment purposes only.